This is HealthCall Online, the place for extended versions of interviews you hear in our weekly radio broadcast, the HealthCall Radio Hour. You know, on this program, we focus on trying to age well, feel as good as you can as those years pile up. And for many men, that involves testosterone supplementation. However, there are several guys who just putting on the brakes. They've seen the publicity, they've seen all the crazy marketing out there, and they may be skeptical, or maybe they think it's a cancer risk or some other way is going to damage their health. I have been using testosterone supplementation for a number of years and just have to admit that I think it's really helped. But I want to talk today to someone who's a more neutral voice. Well, maybe not neutral. Dr. Bruce Dorr is actually an advisor for a company called BioT that specializes in hormone education. So, Dr. Dorr, you're not really neutral here, but I'm going to ask you to be authoritative and credible, and I think you'll be able to do that, right?
I'm going to do my best. Thanks, Lee.
All right. Okay, good. I want to dive into some of the issues around testosterone supplementation and get through kind of the hype and let's get to the science first. And what do you see as the primary benefit?
Well, many men come about this for different reasons. And sometimes it's driven by their illnesses. That can be things such as significant as cardiovascular disease, obesity, diabetes, or osteoporosis in the case of what I hope to talk about as my recently published article. So there are many things that involve our disease and our health, but testosterone is one that can influence disease. Many men come to me or come to, say, a testosterone replacement clinic driven by, say, energy, fatigue, their workouts aren't as good, and certainly libido and sexual issues. But the things that happen down the road, yes, those are quality of life issues, but down the road, testosterone can influence disease and certainly prevent disease when you get a healthier testosterone level. I think that many times you will start seeing reversal of that. It's just a matter of realizing that it's really not as bad as you may think and admitting that, yeah, okay, maybe I can be helped with medicine.
So testosterone production in the typical male begins to decline in their 30s. You lose about 1% of production per year as you age. That's a natural process. So why should we step in and do something about that? If it's natural, it's supposed to be that way.
Well, I think there are many natural processes that start to involve illness. You can start to get renal disease. You may think of viruses or, problems with mentation or things like that as natural illnesses or a natural progression of aging. What I would like for myself, for my family, and my patients is that I want my health line to match my age line. So it's not so much fun to live to 100. So my mom lived to almost 101. And as I saw her aging, especially starting she's pretty good till about 95. But when her eyes start going, when her ears start going, when she's not as mobile or things like that, it's not so much fun to live long if you're not living healthy or you're not aging healthy. So I went through disease or problems with my in-laws, and I would watch these people in these assisted care facilities just sitting in wheelchairs day after day having to be fed. And that's the beauty when we look at hormone replacement or things that are considered natural parts of aging, that, boy, I want to be as healthy and do as much as I can and live the best life. And then, okay, maybe somebody hit me by a bus when I'm 95 or something like that. That's the way I look at it. My wife says that when I bike so often that I'm going to get into an accident like that. So
I'm kind of there as well. I want to be healthy as I can be up to age 95 and then just fall off a cliff. And that's the end of things. Yeah, that wouldn't be a bad way to go.
Well, they say, especially with our vaccines, with our healthcare system, There are people that are being born today that may live to 120, 130. So, like I said, it's not so much fun getting up there if your bones are failing, if your heart is failing, if your brain is failing. And that's what testosterone replacement is about when I look at it.
We're going to go down that road in just a moment. Before we talk about replacing testosterone, let's talk about trying to minimize those things which are destroying the testosterone that our bodies can still produce. There are a lot of things that we do that suppress testosterone production. What should we get out of the way first?
Right. Well, when you look at, say, immunity, when you look at our overall health, about 80% of the time it's coming from our gut and it's coming from our diets. And so when you look at inflammation in our bodies and how our bodies are able to respond to hormones, whether or not that's thyroid, whether or not that's testosterone, the cells, testosterone is a messenger. And if it can't get to where that receptor and where it starts communicating with our cells for energy, for protein synthesis, for things like that going on, then it's a problem. And inflammatory factors, the three biggies in our diet are gluten, so wheat-based protein, especially American wheat-based protein, and dairy and sugar. And so being more cognizant of a more health conscious diet helps us. Being of moderate weight. When we gain weight, fat cells make estrogen, specifically estrone, and that is a killer for our testosterone and testosterone production. Any kind of physical or emotional stress are also killers for our natural testosterone production. So cleaning up our diets, exercising, these are all things that, any doctor going into a doctor or most doctors should be preaching to the crowd to be able to help you naturally, whether or not it's for your testosterone production or to be better receptors to our testosterone.
So I have read that some of the most inflammatory tissue in our body is that central adiposity, the fat that accumulates inside our abdominal wall. And what is the relationship to testosterone supplementation and eliminating that beer belly fat?
Yeah, so higher levels of testosterone help more with keeping our lean body mass where our metabolism comes from, but that can also help us as far as being leaner from that fat perspective. As you lose fat, you lose it kind of equally all over. But yes, that central obesity is definitely associated with inflammatory reactions, whether or not it's healing from disease or whether or not it's primarily preventing disease. So trying to keep that lean waistline, which is very difficult in the face of our standard American diet, SAD for short, is definitely inflammatory for us.
So can testosterone actually help me target and reduce that intra-abdominal fat, or is that just going to be an overall impact?
It is a little bit of both. So testosterone is definitely a metabolic activator. It's interesting, as I pellet or do testosterone replacement therapy for couples, men frequently will start dropping that weight right away. And their wives are like, hey, why is my husband doing so much better than I am? Just simply because the influence of estrogen and what goes on for women is definitely not fair when we look at a weight loss standpoint. But yes, it helps both with energy, motivation, recovery, all the things that are a perfect setup for losing that central abdominal or fat gain, but it also is a fat burner in general. It's our body's natural steroid to be able to help us with that.
Glad you went there. Let's do a quick lightning round on that. Is testosterone going to make me angry, agitated, and aggressive?
Well, so the problem when you go to low testosterone, the body starts looking for, where am I going to get you energy? And it starts either compensating or decompensating in other areas, putting stress on our adrenals, putting stress on our thyroids. And so we start to see deficiencies in those areas. And so when you look at many people look at testosterone and think, oh, I'm gonna buy a Chevy and run people off the road, and I'm gonna get, angry, like you're saying. Those are anabolic steroids. Those are not androgens that are meant to be inside us. But do they bulk people up and have that kind of weightlifter look? They do. But what we're talking about is putting back into the body the same thing that's meant to be there when you felt your best. At 18, I think most people don't feel angry. They sleep great, they exercise great, and they have overall pretty good moods and pretty good outlooks on life. And that's where we're trying to go to. It's this decompensation that starts happening when you start making stress hormones or start running deficiencies in these other hormones as a result of your low testosterone. Your body's trying to help you, but in that sense, it starts to make you, angry or cranky or things like that. When you don't feel good, that's another result that goes on.
Yeah, it sure is. So let's talk a little bit about the prostate and its interaction with testosterone. I think a lot of guys believe, hey, my prostate is already enlarging itself, as happens as we age. This is going to make it worse. I don't want that. Is that a legitimate concern?
Well, so all of us, unfortunately, as we age, the prostate is one of those organs, just like our nose or our ears, that is consistently growing for us. And it grows in the face of not just specifically testosterone, but what I call testosterone's ugly cousin. It's called dihydrotestosterone, or DHT. That specifically acts on the prostate gland to swell and to give us urinary frequency, feelings of heaviness, or that going on. It's not testosterone. In fact, testosterone is somewhat protective in the face of estrogen and DHT when it comes to prostate cancer. And when you look at the studies out there, there's no study showing that testosterone supplementation increases the risk of prostate cancer or causes prostate cancer to grow. Now, when you get prostate cancer, there's an influence of this DHT, estrogen, and testosterone all going on. So they do testosterone deprivation therapy for a short period of time. And then when you look at reintroduction of testosterone after prostate cancer, you can cut recurrences by up to 75% by being back on testosterone again. So men should be overall reassured that testosterone therapy is overall very safe in general. Can they still get prostate cancer? They can, but testosterone in and of itself does not cause prostate cancer.
You mentioned DHT. It is the primary villain in what I've got going on up here, and that is hair loss, androgenic alopecia, as the official name for it, male pattern baldness. Is testosterone supplementation going to make that worse?
Well, it depends on how big of a DHT converter that you are. So many of the more popular medicines to help prevent that are DHT blockers. That's something called finasteride or Propecia, or dutasteride that tends to be used more for the prostate and blocking that DHT and its negative side effects for that. But it also grows great hair. And you can see both men and women that benefit from that DHT blocking. But over 50% of men will have that by age 50, 40% of women will have that by age 50, and they can benefit from that DHT blocker. So it all depends on the genetics that we get from our parents as far as how that DHT influences us. But in general, you should not have an increase in hair loss if you're just going to moderate levels on your testosterone.
Good point. So what is a moderate level? So, the lab tests, I think the typical, and you correct me if I'm wrong, but my understanding is the typical insurance threshold for low T, in which they will cover therapy, is 300.
Right.
Is that correct? And then where do I want to be? What's the target I should shoot for?
Right. When you look at cutoff levels, unfortunately, the cutoff levels is not totally based in science. It was set by the FDA. And that's where this 300 comes from. So, to find a study saying this threshold of 300, I think they had to make a number at some point so that testosterone, therapy just didn't get out of control, which it is a big multi-billion-dollar industry when you look at that. But yes, the criteria, when you look at the American Urological Association, when you look at the Endocrine Society, when you look at the Society for the Studying of the Aging Males, they use that 300 as a cutoff, and that's usually two values on different occasions set in the morning. Now that's when our testosterone is the highest. And then the current guidelines from a number of these societies are to take you to the middle of the range so you don't start getting negative side effects of that testosterone. But many men really don't have reversals. It's about a lot about individualized therapy, because the cutoff for you is different maybe than the cutoff for me, where we start seeing disease. And that can happen at, say, a level of 400 for you or 500 for you, that you start to have disease influence like diabetes, like osteoporosis, or things like that. So when you look at some of the societies and some of the recommendations, there are benefits depending on the symptoms and the disease process that's going on, that you should consider testosterone therapy even with levels above that 300 cutoff. That's where BioT goes a lot, depending on what the symptoms and the disease process is, to consider a replacement for all men based off of their symptoms and disease process, not just a lab value.
So let's talk a little bit about my choices here. I can do many different forms of testosterone therapy. I can do a gel, I can do a cream. So otherwise, I have some other choices. I have to take it transdermally or under the skin, which is what BioT is all about. We'll talk about that method of delivery in a moment, but first I want to get to bioidentical versus synthetic. What's important for me to understand there?
Right. So when you look at regulation in America, it's against federal law to patent and profit what's native to the human body. So the government didn't want one pharmaceutical manufacturer to have the rights on insulin or epinephrine or dopamine, and that translated over into testosterone and estrogen. So the pharmaceutical companies, to get around that patent, say for women, you can patent horse urine estrogen, but as far as patenting bioidentical or 17-beta estradiol, you can patent the delivery system of it, but you can't specifically patent the chemical itself. So when you click bioidentical testosterone, that delivery system can be patented, but not the molecule itself, if that makes sense. So when you look at many of the popular preparations where the pharmaceutical companies are profiting, that is modified testosterone. So it's similar, but not the same. So the problem is similar and same behave differently in our bodies. When you look at shots, those are modified testosterone. That's testosterone cypionate, propionate, undecoate, ethanate, and they all start carrying risks. When you look specifically at the injections of testosterone undecoate, the guidelines are to keep that patient after that injection in my office for 30 minutes because they may have a life-threatening pulmonary embolus, so a clot that goes to their lungs, and they can die in that 30 minutes. Okay, if somebody's going to do that in my office, I don't want them there. I want them in the ER, or someplace away from my office. So that is the influence that goes on. And many people think, like I said, that similar and the same behave the same in our bodies, and it doesn't. So many of the gels are bioidentical. That's the bioidentical testosterone. And there are oral forms, two of which that have just been on the market over the last year, of testosterone undecoate. These are oral forms. I won't go into the trade names for them, but those can raise levels, and these are called what is now called biolymphatic available testosterone preparation. So rather than being absorbed into our stomachs and going through our livers and hepatic portal veins, they actually get through what's called our thoracic duct. It gets directly into our circulation. But those oral preparations now are not bioidentical or the same. Those are testosterone undecoate. But the testosterone undecoate preparations that came out, a couple of big ones last year, those are testosterone directly that you can take orally. But many are gels, just like you're saying. So gels and shots are the most popular. And then there's pellets, both the Testapel, an FDA approved that's delivered a little bit differently than our BioT compounded, but FDA supervised pellets.
So good, let's walk that path. So you're going to inject pellets beneath my skin. Tell me about them, how they work, and why you see that as a benefit.
Yes, so it's not just putting back into your body what is meant to be there. It's about delivering it the same way. So when you put on a cream, up comes your level, down comes your level. So sometimes you have to do that cream a couple different times a day. There are what they call sublingual forms, or what's called a troche. It's a pill you put underneath your tongue. And so also that delivery system, you have to do 2 to even 4 times a day, because the levels will come up and down. Same with a shot. You give yourself a shot, up you come, down you come. So the beauty of a pellet, it's like giving you a brand new 18-year-old testicle in your backside. Now, nobody wants an 18-year-old testicle on their backside. Maybe some people do. I don't know. But anyway, the pellet goes in, your body surrounds it with blood capillaries, and every pump of your heart, in comes testosterone. So the way we were meant to receive testosterone is that blood would flow over our testicles, and if our heart rate is up, we get more. So after a workout, when we're scared, during sex, whatever, when our heart rate is up, in comes more testosterone. We're bathed in healthier testosterone levels for recovery, for anxiety, for all the things that testosterone does for us. So many guys that say go from gels or creams or shots or troches that come over to the pellet side of life are like, oh, this is the way I used to feel, because it's the same stuff delivered the same way. And that's an important point between compounded, or say the pellets that we do with BioT, versus Testapel. Testapel, once it goes in, it's timed released. So you get one dose no matter what your body wants or needs. Whereas the compounded pellets, it's based off of your cardiac output. So it's much more physiologic than the Testapel that's out there, much more physiologic than these other delivery systems.
So how do you modify dose? Is it inserting more pellets, or is it in that compounding process where you increase the concentration?
Yeah, so you basically have, with us, there are 2 different doses of the pellets. It comes in 100 milligram or 200 milligram. So it does depend then on how many that we're putting in. So BioT has a clinical decision support software. So based off of the patient's weight, age, testosterone level, it will come up where we get thousands of men to that promised land, trying to target more the upper quartile of that lab reference range. When I look at what I want for my patients, I want to be an A student. I didn't get it out of my kids all the time, through school and through college, but that's what I want with my hormones. Rather than going to the middle, most people do best when they're in that upper quartile when we look at resolution of symptoms and disease. And that's where we go with that amount of pellets that we're putting in. And we redraw labs to confirm that.
How often am I having these pellets inserted?
Well, everybody's different. So, somebody that's sitting behind a computer all day long is not going to burn through the pellets quite as fast as somebody who is riding their bike, or like me, I just can't sit. I do triathlons and that kind of stuff that I burn through the pellets a little bit faster. So, the larger pellets that we have, the 200 milligrams, usually last towards 5 months. The smaller pellets usually last around 4 months. And that's also the beauty of it. So you're doing something a couple times a year rather than putting a gel on once or twice a day, rather than putting a tablet underneath your tongue up to 4 times a day, putting shots into your abdomen or into your thigh, say a couple times a week. It is a little, nobody likes to get the pellets inserted. Nobody wants that, procedure, but is it more convenient than once they're in than this daily things that you miss, or you're going on vacation and you forget and then you don't feel so good. So that's the beauty of that delivery system and the negative of the delivery system too.
Send us home with a final thought for people. If they've watched this deep into the interview,
Right.
they've got a high interest level. How do I know what's the right first step to take? Do I see my family physician? Are they going to be up to speed on what's going on here? What's the right first step?
Well, in general, yes, it starts with a lab draw. And most physicians are good as far as drawing that testosterone level. But what you're able to do with it and to know all of the choices out there, that gets into a little bit more, nuance to know what that is. And unfortunately, when you go to many of these clinics, if all they do is injections, if all they do are creams, if the only thing that they do are pellets, then that's what you get oriented to. So it's nice to go to a provider that can give you everything. So I kind of look at me as the Walmart of testosterone, that I kind of do it all. So there are people who don't do well with pellets, or there are people who don't do well with shots or things like that. So it's nice to be able to have that. And we try to go over that education with all of our providers within the BioT network, but there are many clinics. It's just important once you get that value or you have these negative symptoms or negative health things going on, to weed out. And usually you're going to know, within that first interview, many times that first visit is free when you look at some of these testosterone replacement clinics or providers, that you're going to know, okay, they're only offering me this. And to seek out that. And many times you're going to find that on the internet to be able to weed through that they offer more than just one thing.
All right. Well, Dr. Bruce Dorr, in the show notes, I'll put a link to how people can get in touch with you, also BioT, so people can learn more about the product that you support. And enjoyed talking with you once again. Thanks.
All right. Always great to be with you, Lee.